Taoiseach, you'll be aware of a recent settlement regarding a Mr Gary Call of €2 million without liability after he had lodged proceedings regarding exposure to dangerous chemicals while working in the Air Corps. I don't wish to discuss any case before the courts. Many affected don't want to have to go to the courts. But as a matter of policy, your department has a responsibility to ensure issues regarding former Defence Forces personnel are addressed, particularly if their health has been compromised. You will be aware of the organisation Air Corps Chemical Abuse Survivors, and I sent you their demands last night. My first question, will you bring in measures to ensure the medical care of those affected?
Well, firstly, I want to acknowledge at the outset, and there's always times for argy-bargy in this House, but I want to acknowledge at the outset the constructive way you've engaged with me and my office in relation to passing on the views and the concerns of the ACCAS, and I will endeavour to also engage constructively in return on this. It's important to state clearly at the outset that the health and well-being of the men and women working in the Air Corps and the wider Defence Forces is of the utmost priority for me, both as Taoiseach and as Minister for Defence. I take my responsibility to those who commit to military service to the state very seriously indeed, and I know that the Chief of Staff of the Defence Forces, together with the Secretary-General of my department, are with me on this position. As Deputy O'Leary is no doubt aware, there are a number of cases, as he said, before the courts alleging historical exposure to toxic chemicals in the Air Corps. As members of this House, we must and we are respecting the separation of powers and the constitutional independence of the courts, and I know we're not engaging in commentary and debate that may encroach on the independence or indeed prejudice a fair hearing. As you will be aware, the HSA has overall responsibility for the administration and enforcement of health and safety at work in Ireland. They monitor compliance with legislation at the workplace, and they can take enforcement action up to and including prosecutions. The HSA carried out inspections of the Air Corps in 2016, and in October of that year issued a detailed letter to the Air Corps setting out a list of safety measures which required attention to improve the standards in place. The Air Corps engaged with the HSA and set out in detail the response being implemented. Upon completion of the improvement plan, the HSA then closed its investigation. Arising from matters contained in the report of the Independent Review Group, the HSA completed inspections of a number of Defence Force installations at the end of 2023 and the beginning of 2024. This included an inspection of Casement Aerodrome in Baldonnel. The Defence Forces prepared an action plan to address the issues outlined in the report, and the HSA subsequently conducted follow-up inspections and noted ongoing improvements. The Defence Forces are committed to complying with health and safety legislation and ensuring the best standards are adhered to. I know the Deputy appreciates that litigation is ongoing. It's inappropriate for me to comment further, but it is important for me to say that separate and distinct from ongoing litigation, the Defence Forces Tribunal of Inquiry will investigate the response to complaints made. So, apologies.
Taoiseach, and it's for this reason that I communicated this to you last night. My primary concern, and it is important that ongoing monitoring is happening, my primary concern relates to the issues that have arisen in the past 20 or 30 years. For many years, personnel in the Air Corps, particularly those in the shop, the repair shop, were exposed to very dangerous chemicals. Despite this, there was no meaningful precautions in terms of health and safety until very recent years. In the meantime, hundreds of personnel were exposed. According to ACCAS, they have identified some 97 untimely deaths since 2000 of Air Corps personnel that may potentially be connected. I'm not sure if you saw the primetime segment in relation to this. It interviewed a man, Paul Flynn, from his hospital bed. So some of the people affected by this are very, very ill indeed, and others have passed away. So this is a matter of the gravest seriously. We know that this is not an issue unique to Ireland. In Australia, there was the SHOAMP study of health outcomes aircraft maintenance personnel. Will you put in place a similar model to assess the health of the former personnel?
Yeah, look, I want to reflect on what you said to me today and what you conveyed to me by email on behalf of the ACCAS last night. And I say that without prejudice or conflation with any other issues that are ongoing, be it issues before the courts or be it issues that will be rightly examined by the tribunal in terms of how complaints are handled. I think the point you're making to me is, regardless of both of those facts, which are important issues, regardless of them, there are people in Ireland clearly presenting with health needs. And I think what you're asking me is, can more be done in the here and now to try and recognise that and respond to those health needs and health concerns. And on foot of your constructive engagement with me and the correspondence you've sent to me, I have asked my officials to give consideration to these matters, to advise me on it, and I'm happy to revert to you in due course.
So, Deputy.
I appreciate the fact that you will reflect on that. You mentioned the tribunal. I would make the point that, and you know your comments reflect that you may be aware of this, the tribunal only deals with the handling of complaints rather than the substance of complaints. Therefore, that is not going to be anywhere near adequate. What ACCS have demanded is is to ensure that there is medical care provided, as well as an assessment to identify what were the implications for their health outcomes. There is also, I think, a need for an investigation, a statutory investigation of some form, given the role of the State Claims Agency failing to alert the HSA of ongoing failings when known. It should go without saying, these are personnel who are part of the Defence Forces, who gave their careers and a long part of their lives to the service of the state. If their health is now profoundly compromised, in my view, the state has a responsibility to them. So you say you're going to go away and consider it. I appreciate that. Will you also meet with those affected, the ACCS and any other organisation?
Let me just take advice on that. I generally like to engage in politics and in public life, and let me just take advice on that, because I am conscious of being a defendant currently in relation to legal proceedings. But let me just check that, and if it's possible to find a mechanism or way to do that, I'm certainly open to that. Look, there have been a lot, and I say this, I'm very conscious of the sensitivities around this. I'm very conscious of the realities for people's health and lives, regardless of where blame or liability lies. That's for others to determine. But I am conscious of the real living impact that people who are speaking in relation to their cases have very clearly told us and showed us. What I'm saying is there have been occasions in this country where, separate and distinct to issues of courts and liability and all of that, and without prejudice to any of that, addressing the health needs of an individual group is something that can be given consideration, and I'm trying to look on that constructively now. Having only taken up this post a few weeks ago, you've engaged with me constructively on it. I thank you for that, and I am happy to come back to you on this directly.